This video will talk about encounters. Encounters are Vetspire's version of exam notes and everything related to a specific visit, whether it's a technician visit, an actual examination, a surgery, or even our medication pickups will all have encounters. To start an encounter for a scheduled appointment, you will go to the appointment and you will see first what time were they scheduled and what time did they arrive. If this person showed up at 8:30 for their 9 o'clock appointment, we would want to let them know that I see your appointment's at 9. You do have a little bit of a wait, but as soon as we can get you into an appointment, we will. We will try to get at least their weight and their intake questions started if they do show up early to try to assist, but we try not to put them in a room until closer to their time frame, just so they don't have to sit in a tiny room without chairs for the remainder of 30 minutes. They also are allowed to go out and take a walk or wait in their car as well. Another thing we watch for is, are they late? Is it 9:10 and they had a 9 o'clock appointment? We do not tolerate tardiness. Sometimes we can still see them. Maybe we had no one show up after, or we had a cancellation, and we might still be able to accommodate, or it's something that we may be able to convert them to a drop-off and be able to work them in between appointments if they leave the pet with us and come back later. Or maybe the pet or the style of appointment will not allow for something like that, and we just need to rebook this appointment altogether. How you handle that is, when it's the specific time of the day, there's this blue line that will tell you what time it is, so that will try to help draw your attention. But you would look and you would say, your appointment was at 9. It is currently 9:10. I need to speak with the doctor to see if we're still able to accommodate this appointment or if we need to reschedule. And then you would come and find myself and ask and discuss what's the appointment for, what time is it, were intake questions pre-filled out or not, and that will help with our judgment call. So this one, if we say that Charmander is on time, things are fantastic, how do we start this appointment? So when we click on the appointment, this box will come back up, and what we want to look for is, did they fill out their intake questions? So there will either be a little tiny person with a circle around them in that bar, or it'll say right here, self-check-in complete. These are questions that will go directly into the encounter and save some time. So that will bring to your attention. If they haven't filled it out, it is fine. You will just fill out the intake question with them while in a room. The other thing we want to look at then is to go up to the pencil and make sure we fill out this information. We want to verify client information, their email, phone number. This was just done, and so for this patient we wouldn't need to redo it. But if it hasn't been a beautiful green box here, it's been a while, make sure you verify phone number and mobile phone. This is where we send text messages to. If they don't have a mobile phone, that's a different area. You have to go all the way over and click and go into the client file to adjust addresses or home phone numbers that are not mobile. That's how you would get to that section. Otherwise, you could mark as verified, and it would definitely put this green box back up. The other thing we want to do on big patients is get the weight out in the lobby and put it into this box, and then hit save and done, and then hit save down here. Patients that need the baby scale, cats, small dogs, we can wait to do that until we get into the exam room itself. Then once you've completed that, you'll hit save, and then you're ready to start your appointment. You click on this button here, and what will happen is each appointment type is tied into a specific encounter and a specific set of questions and formatting that will be popping up. Simple complex wellness is both under annual wellness exams. Regular examinations will just have an exam. Then surgeries have different technician visits, glucose curves, medication pickups. All of those will be different, and I'll show you those later. So this is the intake portion here. It defaults to this area. To the side, some screens you will be able to see the breakdown of every section. Some screens are too small and you may not be able to see this, but what we typically has is the intake section that clients can pre-fill these out, and then we just review and walk through this with them. If they have not filled it out, then we manually need to. Every question is important, and so we want to make sure that we go through and ask every single one. What diet and amount should be not just dry kibble. We want to find out, is it grain-free? There's problems that can happen with grain-free foods, so we want to talk to them about it. We want to know, are they eating tons of treats? That can help us if it's an overweight patient. Questions about travel or cats going outside. These are important because some people don't think that hiking up in Vitavue is traveling outside of Cheyenne, yet they're at risk for picking up ticks, and we need to have that discussion. We can have some people who don't think that 1 week spent in Oklahoma is a bad thing that they should worry about, and they won't mention that unless we specifically ask. We want to talk about things like heartworms or other problems if they're traveling. Things like grooming, boarding, doggy daycare, talking about things like leptospirosis and bordetella. If it's a kitty, do we need to have a discussion about fleas? If it hunts, do we need to talk about tapeworm protections, leukemia vaccinations? So these are very important lifestyle questions that really need to be taken care of. We want to make sure and find out, are they already taking something for heartworm, fleas, and ticks? Are they taking any medications or supplements? We do separate these questions because some owners do not think that a supplement is a medication, and they won't list their joint supplements if you ask them about a medication. Sometimes owners do forget, and that is why at the bottom of this section we do have one about medications that we want to go through and verify, are they still using the medications we have listed? Are they using it at the dose we had recommended? So these are super important parts of every chart. These need to be filled out, and if they weren't on our list, we'll walk through how to add these so we can have it for our permanent record. Any reactions to any medications or vaccines helps us so we can avoid. They may see, yeah, last year we had a really tough time and we had a lot of upset stomachs. Maybe we gave too many treats last year and that was the culprit, or maybe it was the vaccinations. So that will help our discussions. And then some of these are pretty self-explanatory. The more information, the better, especially if it's a sick one. If they say coughing and just do yes, we want to know more. Describe the cough. How often is it occurring? Is it waking them up at night? Diarrhea, are they able to make it outside? Is it large quantities? Is there blood in it? So really elaborate on all of this information by putting and asking more questions. The client may have pre-filled this out and just put yes, but you can go through and still edit and adjust. So please go into lots of details. Any new lumps and bumps, these are super important, and we do have a lump diagram we can add to every chart that we can actually map each of these. So that's important. So we'll show that in a minute. Mobility concerns, even elaborate why. Are they doing anything for it? Itching, behavioral concerns. Some of these questions at the end also fit with our fear-free protocols. We want to talk to them about do they have problems traveling to and from us or anywhere in general? Is there areas that they don't like that we should know? Maybe we don't want to do that air exam first because it'll really elevate its FAS and make them very upset. So all of this is necessary to create what's called our emotional medical record that every patient needs to have, since we are a fear-free practice. Medications, it's also very important that if we did send them home with PVPs, did they give it? When did they give it? That way we know how to judge that medication. If they gave it only 30 minutes prior, we may have a hard time analyzing if that was appropriate or not. So we really want to elaborate. And then here you can also have a section. This is a reminder of please elaborate on everything. If you didn't feel that writing in this space was what you wanted to do for that specific concern, this is a secondary area that you can hand type. Other things in this chart is the patient notes that we see, the client notes, any allergies that we recorded, the reminders when they're due, and problem lists. And then we don't have referring DVMs because we are primary care, but that would be listed as well. And then it dives into the vitals. So this is if it's a small dog or cat and you were doing it in the room, this is where you would input it. If it was already done in the lobby, it would pre-populate here. And this is where we can elaborate on the rest. The bottom section is typically filled out by the veterinarian at the end of the appointment, but any of this information that is gathered by you can get inputted here. This does keep track and show changes throughout, which is kind of a fun thing to be able to pay attention to. This bottom section called the objective one, it defaults to normal. So what we can do is we can click on abnormal and hand type, or go back to normal if we did not mean to. And there's also areas that we can click on up here that says mark all as not examined. This one here, mark all as normal. You can print a label, which we typically don't do. This is the section I'll show you, add new section of where we can add that body map. And this is a nice one that says copy from previous records. If we're doing a recheck on one, we don't have to hand type every single time in, or if it's just the next year and this is an old patient and we've mapped out 50 million lumps or lots of issues, great, we can try to make our life a little easier by copying from the previous years. This section here, this section gives us different templates. The body maps are pretty much the main one you use in these sections. The rest are things for dentals, which we can use if we have problems with teeth or we want to discuss that during an appointment. And then when I do acupuncture, I put this chart in as well. This is a dog, so I'm going to click on the canine body map and I'm going to add it. When you add it, it will go to the bottom of the section you are currently on. And here's our added map here. This one here, this area, you can draw on. You can click here and change colors. You can erase what you did, and then you just click and you will draw just by using your mouse. Over here, you can elaborate on your notes by clicking here. Sometimes you can do it by color. Say orange is lipoma, red is papillomas, and that can kind of help us distinguish things. There's a little trick that if you take both of your fingers and you spread them apart on a laptop, you can zoom in, and that can be a helpful one when you're trying to draw and it's difficult using one of these giant mouse pads. So that's another trick. If you added a section and you didn't mean to, sometimes if you hover over it, a little trash can will pop up. It doesn't look like, oh yeah, this is a delete embedded section right there. So you can always delete it if it was an accident. The next section is called the assessment. The top portion of it will be completed by the veterinarian and will give information regarding the appointment, but the bottom part of it, the emotional medical record, needs to be filled out by the room technician. You can make it move to its own line, and there's prompts for you. We need to think back up top to those questions, and then in general, how did the appointment go? What was the preferred treat? We start on our treat ladder and work our way to high value treats. What worked for this patient and what didn't work for this patient? What were the elevators? If the owner said ears and sure enough we agree, let's put that down. Let's give some suggestions to help make the next visit more successful. Did we do PVPs and did they work? Did they bring a toy from home? What helped? What triggered? What was great? What wasn't great? So we can learn from it on here. So this is an expectation and something to fill out in its entirety. The vaccine section, this is different than the exams, but this is just making sure we checked off and knew what vaccines we gave. By doing this, it helps just make sure that we charged appropriately. We didn't forget a charge when we actually did a vaccination. So make sure the check boxes are filled. That's also a responsibility of the room technician. If there's any additional pictures that we wanted to add, we can do it there. Orders. The nice thing in Vetspire is that this is where you put all your charges. Everything is in one specific area here. You don't have to jump out and jump back in. This is a separate tab. If we order blood work, we have to use that tab. Otherwise, inside the orders, you can click and you can start typing into search for anything you want. Most of the time, we're working on things like canine vaccine packages. There are pre-populated things that will only allow certain weights for certain, like spays have, you could only do a package for a spay for the right patient based on their weight and things of that nature. So if you're not finding something, check up here. Maybe you're searching for a puppy package when it's an adult or something of that nature. But right now I'm clicking on the adult package. What we do is we have different options here for examinations. Was it scheduled as a wellness examination? And we'll pick this exam. Or was this, hey, my dog has an ear infection and oh, by the way, can we also add on vaccines? That would be a routine exam with the vaccines added. So different charges based on that. We don't charge for shelter examinations, and that's why that's on here. And then you would click whatever vaccines you happen to do. We do have both a separate lepto and separate distemper parvo combos, plus a combination distemper lepto. We also have distemper parvo combination with coronavirus for our puppies that doesn't include this. So make sure that you pick the appropriate one that you're doing. If we give a rabies, we don't need to reissue a replacement tag because they get one regardless. But if it's an off year and they need a reissued one, you pick that as well. When you're done picking your list, you add it and you'll see all the information comes here on this system here. Your next role is to update this information. You click on it and then you say, well, where did we give this? Did we give this in the front right leg subcutaneously? The lot number, some of this pre-populates that you don't need to worry about. But the next section is, well, what was this? Was this a 1 year? Was this a puppy one that was boosted in 3 to 4 weeks? And it'll give you different option. Was it a rabies that's either going to be a year or 3 years? So you click the appropriate. This triggers your reminder. And then really you can ignore the rest and just hit update. That will fix it here and fix it in the reminder section here. Inside the rabies, a slight difference is this is where you will also put in the rabies tag. Our format we use is the year with the tag number following. And then you fill out the same information with the additional, and then we know this is a 3 year based on the vaccine we picked, and you would save that as well. So I'm going to exit out because I don't want to save that. So that needs to be filled out for every vaccine as well, and then you'll see the remaining, which was the adult wellness. The bottom portion here then goes on to, did we send them home with flea and tick? What are the options? Did we talk about a dental cleaning, and were there any handouts sent home? The handout section will be down here at the bottom under attachments, where we upload attachments. The next thing we do too is that medication list. So we want to go over this after the intake question. So you can scroll down and you can say, Oh, are you still using the prednisolone? More than likely, this is a medication that was a short time, just like antibiotics. So all of these aren't currently being used. You don't have to ask them. They may not even know what lidocaine is on here. So this is something that was probably from the spay. This is then something you just know in your mind, okay, these were things that aren't a long-term medication and I'll discontinue them. Versus if it was something like carprofen or a joint supplement, we use Movoflex, then that may be a long-term, and let's ask them if they're still using it. Unfortunately, they have a bug in the system and you can't utilize these features right now. Our system, we just switched to this, and none of our medications came over properly that we can use this. So to adjust medications, we'll do a separate video on going up here and adjusting it within that part of the chart. Then the last portions are usually all done with the veterinarian, aside from the fact that the more information you put down, the more helpful it is. Even things of rights versus lefts, when we were up in that abnormal normal section. Did we look at the right ear? Was it the left leg that they're limping on? Where were those lumps? So the more detail you put down, the more helpful and more complete the notes. You can also put this here if we discussed we need to do a blood work recheck or come back for a victory visit or recheck the weight. Anything you hear, you can type here as well. I fine tune, I correct spelling errors, grammatical errors, things of that nature. So never feel bad to just put information down to help jog my memory. The discharge section is a section that gets emailed to the owner. So we have a great way of doing education. Other things that we can use to make our lives easier when we're doing any of these notes is something called a macro. A macro is this slash here, and then it can be anything. We have a list that tells you all these different macros, but they're pre-populated with information that when I click on that, it spews out anything we want to type in. So this is one that's telling owners about PVPs and how we can adjust the appointment for next time, and that we'll be sending PVP homes in the future. We can do educational things about teeth products, heartworm, things of that nature, allergies. So we utilize that, and it can be multiple areas of the clinic that we use. So if in doubt, try to search for a macro and you can look at our list and see. Another thing that's important is we do have this where it's copy medication list. That's why we want to try to do this at the beginning of the appointment, is when we are prescribing a medication and we click that list, it'll pull all of these on. Some patients have so many antibiotics on their list that I'm going through 50 different items and having to hand delete in order to send them the appropriate and today's medication only. So make sure that we try to do that. The rest, if we do any client education handouts, we'll attach them here so they can get emailed at the same time. Here's the other area down here for rechecks. Did we need a recheck of a booster? Any of this information? Do we need blood work or lab work or radiographs? That will all be something that can be emailed as well to the owner. And then this section, do you need to schedule a new appointment for them? You can click here to do so, or do we need to remind them? Do we need them back in 6 months and they may forget for that blood draw? Let's set an appointment reminder to trigger in 6 months' time to come back for blood work by filling all of this out. And then another thing is tasks. We want to put in a new task if it's a sick patient. We want to check on them and see how they're doing. Just put a task in and pick a date saying, I want to check on this patient next week. Let's see how they're doing. Did we do blood work today? And we want to remember to call them back. Let's put that in here. Call back with blood work and put today's date. Put the encounter that we were doing here so we know what it's triggered to, and make sure to pick the appropriate people too who need to participate in that task. And then these two can be ignored, but if there's anything super important here that you can put in as well. So just fill that portion out too. The rest of the encounter form, this section here down below, this is where you need to make sure to put your name in. We need to make sure to have the correct person associated with this account so we know who the room technician was. Consent forms, do we need to generate one? Were we surprised and we're keeping this patient and doing something? Well, we can come in here and generate a consent form from this list. An estimate, do we need to give them an estimate for anything? Were they curious about the cost of the supplements? Do they want to know what that spay costs? This is where you can create and save it. The next is the invoice, which we'll go over in a minute. Sharing is what I click at the end to send the email information to the owner. And then signing for examinations in a room is done by me. Technician and medication type of drop-off, those are signed by the technician who does it. It can be unsigned and fixed if you forgot to add something later, but for the most part, when we sign it when we're done with it. I will sometimes leave it open if I'm done on my end, but you're not done putting in the emotional medical record in the assessment section or anything else. It may still be open and you'll have to come and do your portion too. To finish off this area here, we'll do another video that talks about how to charge people out. Otherwise, the rest of the forms will be covered, these tabs will be covered in the chart. But make sure too that you're catching if there's anything in orange, missing color, anything that you need to fix, please do. And here's information here that you can look to make sure, did we have the right phone number and whose was that? Did we have an email or do I need to catch that and check that? Is there anything else like, oh, this client does get a senior discount. They have this senior tag here and they do get a discount for that. So that's an encounter in a nutshell, and we will go through how to do charges after.